Chemotherapy Basics here at 3Rivers Cancer Center. Our goal is to help you understand your cancer treatment and to guide you and your loved ones on how to actively participate in your care. This session is designed so that you may understand basic knowledge about chemotherapy and possible side effects that you may experience, to clarify new terms that you may also hear. Your healthcare team here at 3Rivers Cancer Center, including your nurses and doctor, will share more details during your visit. We encourage you to ask all of the questions that you have. None are too small. And with the knowledge gained here, we hope that you will feel well equipped to manage any side effects that you may have. We are on this journey with you every step of the way. We will start by explaining some terms and then walk you through a typical visit. What is chemotherapy? Chemotherapy, sometimes called chemo, refers to the medicines that are used to directly kill and target cancer cells. They stop the cancer from growing, multiplying, or spreading to other parts of the body. These medications circulate through the entire body to reach cancer cells that may have spread from their original location. And for this reason, chemotherapy is sometimes called systemic treatment. Most often, chemotherapy is administered through an intravenous line, but it may also come in pill form for you to take at home. Some patients may need a device called a port inserted under the skin to make IV administration easier, which can remain in place for months or even years. Other medications that may be part of your treatment include biologic therapy, monoclonal therapy, targeted therapy, or hormonal therapy, which work differently from chemotherapy but may be part of your treatment plan. How chemotherapy is given. Not all chemotherapy drugs work the same for every type of cancer. You may receive a single medication or a combination of drugs depending on your treatment plan. The combination of drugs that you receive is called your chemotherapy protocol or treatment regimen. You will receive information about your chemotherapy in the cancer clinic before you start treatment. A typical course of chemotherapy lasts around 6 months, with treatment frequency ranging from once a week to once a month. Each visit can last anywhere between 30 minutes to 7 hours, depending on your specific regimen. Common side effects. As many medications, chemotherapy may have side effects. Side effects are the unintended actions that occur as a direct result of taking a medication. However, not all chemotherapy causes all side effects. Chemotherapy doesn't cause side effects in everyone, and different people may have different side effects. It's important to remember that the severity of the side effects does not indicate how effective the treatment is. Some side effects may be temporary, but some may last longer, and your doctor or nurse will discuss the side effects specific to your treatment plan and explain which ones are short-term or long-term. Here are a few common side effects that you might encounter. First is hair loss. Chemotherapy works on cells that grow at a fast rate, both the good and bad cells. For example, our hair cells grow quickly, hence some chemotherapy drugs cause hair loss. You may consider hats, wigs, or scarves to manage this. Secondly is nausea and vomiting. Anti-nausea medications will be prescribed to help manage these symptoms. Please take them as prescribed and inform your doctor if they are not working, as there may be other medications available to help. Thirdly is low blood count. Chemotherapy can reduce your white blood cells that fight infection, red blood cells that carry oxygen, or platelets that make blood to clot, making you more vulnerable to infections or fatigue. This will be monitored by your doctor before each treatment, and during this time it's encouraged that you wash your hands frequently and avoid crowds or people who are unwell. Fever may be a sign of infection that needs to be urgently evaluated when receiving chemotherapy. Fourthly, mouth sores and taste changes. Some chemotherapy drugs affect the lining of your mouth, and this may cause mouth sores, taste changes, dry mouth, or infection. It's important to maintain good oral hygiene by brushing your teeth twice daily and rinsing with a solution of salt and water. Another side effect is fatigue, which is a common one that can last even after treatment ends. This can be worsened by dehydration, hence staying hydrated and engaging in moderate physical activity like walking can help to manage your fatigue. Other side effects include diarrhea or constipation. Please notify your doctor if you have persistent diarrhea or if constipation occurs, as this could lead to further complications such as dehydration. Skin reactions may occur as some treatments can cause rashes. Keep your skin clean and moisturized and apply sunscreen when outdoors. Infusion reactions are like allergic reactions and can range in severity from mild to severe based on the treatment you're receiving. If you experience any discomfort like pain, itching, or trouble breathing during an infusion, inform your nurse immediately. Fertility concerns. Some chemotherapy may influence your fertility or impact your ability to have children in the future. If this is a concern for you, please discuss it with your healthcare provider, and it is crucial to avoid pregnancy during chemotherapy, and your doctors here at 3Rivers can recommend appropriate birth control methods safe for you. In terms of nutrition and hydration, it is important to maintain a healthy diet during treatment. Eating smaller and more frequent meals may be helpful if larger meals are challenging. During chemotherapy, some foods may be more appealing than others, and it might require some trial and error to find out what food works best for you. Be sure to tell your doctor of any supplements, over-the-counter medications, and herbs that you're taking, as these may interact with the chemotherapy. Also, drink plenty of fluids, particularly before and after treatment, to prevent dehydration. In terms of cultural perceptions of chemotherapy in our context, so many African societies, including here in Uganda, view chemotherapy with fear or suspicion due to cultural beliefs and traditional practices. Some people may turn to herbal remedies or alternative treatments, influenced by the belief that they are safer or more natural. While we respect the role of culture, it is important to understand that chemotherapy is a scientifically proven method to treat cancer, and it's carefully tailored to each individual's need by experts. We encourage you to have open conversations with your healthcare providers here at 3Rivers and ask any questions that you may have, and trust that our treatment plan for you is recommended as designed for your best possible outcome. Working together, we can combine respect for our cultural values with the most efficient medical care available to help you on your journey to recovery. Some helpful tips. Wear comfortable clothing during treatment. Bring something to do like a book or electronic device to pass the time. Our infusion center here at 3Rivers has televisions available for entertainment. Eat a light meal before treatment and avoid eating your favorite foods on chemo days in case you don't feel well. It may cause you to develop an unpleasant association with your favorite foods. You're encouraged to bring a family member with you until you know what your response is to treatment. We are here to support you through your treatment here at 3Rivers, and for more information, feel free to reach out to our healthcare team. We are committed to excellent care and your well-being.